No, this is the Morning Rush here on Metro Television. I beg your pardon. And, well, of course, my name is Desifeni, the Star Boy. And we're going to talk about something. Dr. Prince Osei, as you know, on Fridays joins us for us to talk about your health, how we can improve our health. And this one we are discussing something that's not about our agenda. But yeah, that's what it is. We care so much about our females out there. And so we're going to have this conversation. And it's called the Pelvic Inflammatory Disease, PID. And so Dr. Prince Osei from Medi is here. Doc, good morning and welcome.
Good morning.
As I'm talking about something, so I kind of figured I was on a theory, but anyway, good to have you once again.
Yeah, great to be here.
PID.
Yeah.
It's a female thing.
Yes, it's called pelvic inflammatory disease. And, the female reproductive system is supposed to be the neatest or cleanest part of the female body.
Okay.
Because that is where life starts. So there are so many mechanisms that prevent infections from going there.
That one I really may not understand. I've heard that a lot of times.
Yeah. There are so many mechanisms. The cervix is the first. The cervix is the first part. There are a lot of things that can enter the vagina, but into the uterus itself, there are so many mechanisms that prevents infection from it.
Okay.
The cervix is one, and there is a mucous lining within the cervix that also prevents infection. There is the acidity of the vagina, also prevents infection from entering the uterus. So all these mechanisms make sure that unwanted particles or unwanted organisms do not get access into the uterus, because, as I mentioned earlier, it's supposed to be the most cleanest part of the human body.
Okay.
Yeah, but sometimes the things that we do, some activities that we indulge in as women, could expose the uterus to a form of infection.
Okay.
And that is what we term as pelvic inflammatory disease.
Okay.
So pelvic inflammatory disease simply means that infection within the female reproductive system. So if the female reproductive system is infected, then we term it as pelvic inflammatory disease.
Okay, interesting. So how does one get that? How does it happen?
Yeah, so mostly is a bacterial infection. So any form of bacteria at all could cause it. But the major form of bacteria that can enter the uterus is mostly the gonorrhea bacteria or the chlamydia bacteria. Okay. So these two ones are the major ones that can easily get up there to affect the uterus and the other organs in there. Yeah, so other things that we do, like having unprotected sex with multiple sexual partners, could be one of the major things that can expose women into having this type of infection. And also inserting things into the vagina, because as I mentioned earlier, the cervix is there as a barrier, the mucous lining is there. But we have some women who may doching, putting things within inside the vaginal canal to make it look clean.
Oh, yeah. So thinking that they're cleaning the place.
Yeah.
Okay.
Yeah. Sometimes women may have some form of infection and they may be inserting certain things, some perfumes and other things in there to clean the place. But the vagina itself has a way of cleaning itself. Yeah. Okay. So you don't need to introduce an external thing in there, because when you do that, it can distort the normal vaginal flora, also weakening the uterus, the cervix, so that infections will have its way in there. And also, if you are, sometimes we advise women that when you are washing, when you are bathing and you are washing, you have to use clean water. Sometimes we fetch water into a bucket, and after we bath, we use it to wash. When you are bathing, some of the soap may get in the water, and when you use it to wash, the pH of the soap is mostly basic, and the vagina has to be acidic. So the more you introduce basic things there, it means that it will distort the vaginal flora in there. So the normal flora in there will be distorted, and then infection can find its way in there. And sometimes that when the vagina too is a bit bushy, there could be sweat. It can trap sweats and all that. And sweat contains bacteria and other things which can find its way in there, which can cause this type of infection. So these practices, mostly unprotected sex, multiple sexual partners, doching, those are the major things that could cause these forms of infection.
Okay. I don't know if it is very popular out there that a lot of the women know, but how would someone know that I've got PID?
Mostly, it wouldn't give any symptoms. That is one thing about it. It wouldn't cause any symptoms. You wouldn't find anything. But when it advances, what you may see is pelvic pain. So you start having pains in your lower abdomen.
Okay.
Yeah, because that is where the uterus is. When the infection climbs up there, it can cause these pelvic pains for the women. And also, you start having pains after sexual intercourse. So once the cervix is infected or the cervix is affected, it means that when you are having sex, the penis touches the cervix, it could cause some pain. Instead of you having fun with the sex and all that, you start having pains within your pelvic area. And also, you may have intermenstrual bleeding. So you finish with your menstrual period, but you see that there will be some blood spots in there. And sometimes you may have heavy vaginal discharge. So let's take note of this. There is this normal vaginal discharge, but when you have PID, the discharge will be very heavy. And it will be offensive because it's a bacterial infection. You know, there are forms of infection that women can get. We can have fungal infection, we can have viral infection. But when it comes to the bacterial infection, which the PID is a form of it, the infection, the discharge that you get is mostly offensive. It has some bad smell, and sometimes it comes with some itching and all that. And when it progresses, it means that it can even lead to infertility. There are women suffering from infertility that is as a result of PID. It's as a result of an infection that wasn't well treated. So all these can contribute to women having infertility. And apart from it affecting the uterus and all that, the pains and all that you get, you start also having irregular menses. So your menses wouldn't be as it should. Yeah. So some women complain that it used to come for like 3 or 4 days, but now 2 days. Some even complains that 1 day, then the menses will stop. It's all signs of symptoms of the PID that is manifesting itself. Yeah.
Okay. So a lady would get to know that she has PID when these symptoms come up. So what's the treatment like?
Mostly you need to, sometimes when women have these forms of symptoms that I'm talking about, they go to the pharmacy to get themselves certain drugs. But as I said, the PID is a bacterial infection. So if you go and you are given something for fungi, it means that it wouldn't be able to treat it. So self-medication is not the best. You need to be well diagnosed. You need to come to Medmosis to get screened, because you can only know that you have PID when you've been screened. You have a pelvic scan. So we do a scan to check the uterus to find out if there is any fluid accumulation. Mostly when you have the PID, there will be fluid accumulation at a part of the uterus, which is called the pouch of Douglas. There's a part of the uterus called the pouch of Douglas. There will be fluid accumulation around those areas. So when you have the PID, the fluid will be collected there. So when you do a pelvic scan, it will reveal that there is infection in there. And the type of infection too will be done. Like we'll do a test to know the specific type of infection, because as I mentioned, gonorrhea can cause that, chlamydia can cause that. Other forms of infections too can cause that. But these are the two major ones. So we need to do a culture to find out. And when it's done, then there are medications, antibiotic that people may use. But the unfortunate thing is, most people have abused these antibiotics. At first, these common antibiotics were able to treat it. But now, because of something that we call drug resistance or antimicrobial resistance, women may have infection, go to the pharmacy, get some antibiotics. They are told to take it for a period of like 5 days. But they will take it first, second day, the symptoms will go. So they may think that they'll stop. So they'll stop taking it. And when you are dealing with any organism, when you are treating an infection and you don't complete the course, it means that when you take it and the symptoms subside, it means that some of the bacteria will still be there, but then their quantity is not so much to give you the symptoms. So you find out that the symptoms are not there, but then the condition is there. So most of the antibiotics, most of the bacteria has grown resistance to the antibiotics that we use. That is why Medmosis brought in Fimacure X capsules. Yeah, so Fimacure X is a multi-drug resistant product.
So Doc, So that is with the treatment.
Yes.
You need to go to the hospital
Yeah.
to get to that.
Yeah.
If you try to do self-medication, you may not get to right.
Yeah.
Right. Okay, so just hold on before we get to Pelvic X. Well, if you just join in, this is the Morning Rush here on Metro Television, and we're talking about pelvic inflammatory disease, that is PID, with Dr. Prince Osei from Medi. You can send us your messages 0553 000035. If you're watching, if you've got any questions, 0553 000035. Now, when you have these symptoms, you need to go to the hospital to go check it out. If it is untreated, what will happen?
You know, most women start having something that we call ectopic pregnancy.
Okay.
Ectopic pregnancy means that you get pregnant, you've tested, it's positive, but then the fetus or the embryo is not able to move from the fallopian tube into the uterus. So fertilization takes place in the fallopian tube. Then it moves from the fallopian tubes into the uterus. But when you have PID, the fallopian tubes can narrow. So the size of the fallopian tubes can narrow. So when the embryo is formed in the fallopian tube, it may not be able to move into the uterus. Then you may have ectopic pregnancy.
Okay.
So, and when you have ectopic pregnancy too, the only way is surgery, is through surgical removal. We have to take that part of the fallopian tube from it. Okay. And when it's taken off, it means that your chances of having a baby is halved, because the fallopian tubes are two and one is taken off. So it means it's just one that will be functioning. So that is one of the major risk factors that pelvic inflammatory that can cause. Apart from that, it can cause something that we call tubal blockage. So some women seeking for fertility, they are looking to have a child, they may go to the hospital and do a test called hysterosalpingogram.
Okay.
And it will be revealed that the fallopian tubes are blocked. The reason why the fallopian tubes are blocked is you had an infection. The infection traveled to the fallopian tube and it wasn't well treated. So the discharge that were supposed to come out and all that got stuck within the fallopian tubes, and it can block the fallopian tube. So it means that when you release an egg, it wouldn't be able to travel through the fallopian tube. Or when you have sex and the semen is releasing you, the semen wouldn't be able, the sperms wouldn't be able to travel to meet the egg. So the tubes will be blocked, and it can lead to infertility. When you have the blocked tubes too, sometimes your only option, if it's bilateral, if both of the eggs are blocked, your only option you may have in having a child may have to be an IVF, that is in vitro fertilization. Okay. So it's one of the complications that can cause. Also, as I mentioned earlier, it can distort your menstrual cycle. Your menses wouldn't be flowing as it should. But the major risk factor is the ectopic pregnancy, and the blocked tubes. Yeah.
Okay. So that is how come Medimosis is always caring about people what's in the Pharmacure eggs.
Yeah. So the Pharmacure eggs, what it does is, because of the multi-drug resistance that I mentioned earlier, most of the bacteria has grown resistance to it. So Pharmacure eggs was designed in such a way that it's the drugs that are, the organisms that are grow resistance to the drugs, to be able to overcome it. So if you've taken so many antibiotics and your body is not responding to any of the antibiotics, we do something that we call a culture. We do a culture. We take a sample of the discharge and do a culture. And sometimes we find out that most of the organisms that the culture will be able to treat it, it's not able to treat. But then with Pharmacure X, it's able to treat majority of the infections, be it gonorrhea, be it chlamydia and all that, it's able to treat. And also with its ability to revive the hormones and all that, it's able to also prevent these forms of menstrual issues, the menses not coming well and all that. It's able to fight all that. So your menses will be able to flow well. The pains that you have to you used to feel when you are menstruating will all be resolved and all that. So, and luckily enough, Pharmacure X is available in every pharmacy. When you go to any pharmacy, you'll get it. But make sure that you get tested first before you get it. Yeah. You need to do a pelvic scan. So you need to do a pelvic scan. You can come to Medimosis to do a pelvic scan to be diagnosed of the PID before you go in for the Pharmacure X. Yeah.
Okay. So Pharmacure X has got you covered when it comes to PID. Just make sure that you go to the hospital to check it out and make sure that you have the right diagnosis before you go get Pharmacure X. That is, if you want to really treat it, you need to go get Pharmacure X. And so just walk into any of the branches of Medi as always. Doc will take us through that.
Yeah, so the head office is at Adenta Barrier. It's a diagnostic center. It's a dental clinic. It's a prostate center. It's also a herbal clinic. So it's all in one. When you come in, you are sorted out, and you can walk in. You don't need to be a patient there to get access to all these facilities. You can come in, have a lab test. You can just walk in, do a pelvic scan to make sure if you have any of these conditions, or make sure that everything is fine. Adenta Barrier, close to the police station. When you're on the police station, it's on your left. When you are around Tema, Ashaman area, we are at Ajay Kojo, behind the school for the deaf. We have another branch there. When you are in Tema, Accra Central, we are in the AESL building, Ministry of Road and Highway. Yeah, we have another branch in there. Kumasi people can go to, Ahinema Kokobin. Yeah, Ahinema Kokobin. Our numbers are on the screen. You can pick. If there is any questions that you need to find out, you can call us and we will gladly answer you.
Okay, so today is for
women,
for the women. But for the men, of course, there's the
Prostacure T, Prostacure X. That is for, it improves the urine flow. If you have any symptoms with urination, straining to urinate, incomplete urination and all that, Prostacure X, Prostacure T has got you covered. If you're having erectile issues, if you're a man, the erection is not as strong as it should, Aphromosis.
Aphromosis is there for you. The Savior is there for you.
It's there. But you know, there are some men who may have the erection and all that, but premature ejaculation. Yeah, within some few minutes, then they ejaculate. Then you need Medi Plus.
Medi Plus.
Medi Plus.
Aphromosis plus Medi Plus.
Medi Plus. So if you're having both, if the erection is not good, if you have premature ejaculation, then you need to combine the both, Aphromosis and Medi Plus. Yeah. And also we have Femacure X, as I mentioned earlier, for female infertility issue, for menstrual issues, for infections and all that. And also we have the Master T, is an immune booster. So Master T is for all ages. It's for old, young, anyone at all can take Master T. It boosts the immune system to be able to fight all these forms of infections. And it's available in every pharmacy. Wherever you go to, you can get all these medications from Medimosis.
Okay, so that's it. Dr. Prince will say thank you for coming. What's the plan for today? Or the weekend? It's okay, you don't want to tell us. It's okay. So that's Dr. Prince will say from Medimosis. Thank you so much for coming. And that's it for pelvic inflammatory disease, PID.